Barbiturates are classified as CNS agents, anticonvulsants, and sedative hypnotic drugs. The barbiturates act at another binding site and similarly enhance the action of GABA. Barbiturates potentiate GABA action on chloride entry into the neuron by prolonging the duration of the chloride channel openings. In addition, barbiturates at higher doses can block excitatory glutamate receptors. Anesthetic concentrations of pentobarbital also block high-frequency sodium channels. All of these molecular actions lead to decreased neuronal activity. Because of the decreased excitatory transmitters, barbiturates are far more depressant than BDZs. In the absence of GABA, BDZs and low doses of barbiturates do not affect chloride conductance. Initially, barbiturates suppress REM sleep, but with chronic therapy, REM sleep returns to normal. Barbiturates readily lead to dependence, and relatively small overdosages may be fatal. Barbiturates are primarily used to treat insomnia, although they are also used for partial epilepsy and tonic-clonic seizures. Barbiturates, like thiopental, are now little used in anesthesia, but are still sometimes used as anticonvulsants, like in the case of phenobarbital. Adverse effects. Potential addiction may result from the use of barbiturates. Hypnotic doses of barbiturates produce a drug hangover that may lead to impaired ability to function normally for many hours after waking. Barbiturates cause drowsiness, impaired concentration, and mental and physical sluggishness. Occasionally, nausea and dizziness occur. Barbiturates induce cytochrome P450 microsomal enzymes in the liver. Therefore, chronic barbiturate administration diminishes the action of many drugs that are metabolized by the CYP450 system. Abrupt withdrawal from barbiturates may cause tremors, anxiety, weakness, restlessness, nausea and vomiting, seizures, delirium, and cardiac arrest. Withdrawal is much more severe than that associated with opiates and can result in death. What are the contraindications and interactions? Barbiturates are contraindicated in anyone with a familial history of porphyria, a genetic disorder caused by deficiency of enzymes of the heme biosynthetic pathway, and in cases of severe respiratory or kidney disease. They should be avoided in patients with a history of previous addiction to sedative hypnotics or uncontrolled pain, and in women who are pregnant or lactating. Alcohol may interact with barbiturates because of these agents' similar CNS depressant qualities. The barbiturate phenobarbital may decrease absorption and increase metabolism of oral anticoagulants, and may also increase metabolism of corticosteroids and oral contraceptives.